Hello everyone, I'm Dr. Hung, with over 25 years of experience in elderly healthcare. Today, I'd like to take you on an important journey, a journey no one wants to think about, but one that could transform how you love and care for your loved ones. Have you ever wondered, why has my father suddenly stopped wanting to eat? Why is my mother tired all day? Could it just be old age? Or, is something happening that I haven't noticed? The truth is, death doesn't come abruptly like in the movies. The human body, especially in older adults, often sends warning signals months, even a year, before reaching its final stage. The problem is, we tend to overlook these signs because they're so subtle, so small, that they don't catch our attention right away. In this detailed and in-depth video, I'll share with you 5 critical signs I've observed in thousands of patients throughout my career, signs that, if recognized early, can help you improve care quality, prepare yourself mentally, and most importantly, ensure your loved ones pass away in comfort, peace, and dignity. This isn't a video to scare you, it's here to empower you with knowledge, the most powerful tool to face the inevitable. Stick with me until the end, as I'll dive deep into each sign with a medical perspective and practical experience. If you don't want to be caught off guard by changes in your loved ones, hit the like button now. Grab a glass of water, and let's get started. Main content: 5 key signs. Sign 1. Significant weight loss. Unintentional weight loss is one of the earliest indicators that an elderly person is entering their final stage of life. At first, it might just be looser clothes, a belt needing tightening, or a gradually fading appetite. Many assume this is a normal part of aging, but in reality, unintentional weight loss is rarely a good sign. It suggests the body is no longer absorbing nutrients effectively. Muscles are wasting away, and vital systems are slowing down. This isn't just about diet, it's a signal that the body is preparing for a larger transition. As a doctor with over 2 decades in this field, I can confidently say that unintentional weight loss in the elderly is one of the first signs I check when assessing overall health. The human body operates like a complex system, and when it begins its final decline, the metabolism of nutrients, particularly proteins and calories, is severely disrupted. Picture the body as a factory. When raw materials aren't processed well, production lines slow down, and the final output diminishes. Medically speaking, unintentional weight loss is often tied to a condition called cachexia, a state where the body loses not just fat but also lean muscle mass due to metabolic dysfunction. This differs from typical weight loss in younger people, which is usually due to diet or exercise changes. In the elderly, cachexia can stem from multiple causes. Weakened digestive system. The stomach and intestines no longer produce enough enzymes to break down food, leading to poor absorption. I often see patients lose the ability to digest protein, the key component for muscle maintenance, because the liver and kidneys aren't filtering efficiently anymore. Hormonal changes. Hormones like ghrelin decrease, while cortisol rises, pushing the body into a catabolic state, essentially breaking itself down. Underlying conditions: cancer, heart failure, chronic kidney disease, or chronic obstructive pulmonary disease are silent culprits. For instance, in cancer, malignant cells release inflammatory cytokines that accelerate energy depletion. During examinations, I typically ask families, are they eating less? Skipping meals? Complaining about food taste? If the answer is yes, I request a check of their body mass index and serum albumin, a blood protein reflecting nutritional status. An albumin level below 35 grams per liter signals a serious deficiency. Here's what I want to emphasize: don't rush to force them to eat more if they resist. I've seen families stuff patients with nutritional porridge or high-calorie milk, only to exhaust them or even cause vomiting. Why? Their bodies can't handle large food volumes anymore. Instead, focus on quality: a bit of warm soup, a spoonful of digestible yogurt, or vitamin C-rich juice to boost immunity. Over time, weight loss doesn't just affect the body, it impacts the mind. As muscles waste away, the elderly become prone to falls, a major risk leading to hip fractures, with statistics showing 20 to 30% of patients over 65 die within a year of such an injury. Plus, low energy weakens immunity, making infections more likely, a topic I'll cover later. My advice: if your loved one loses over 5% of their body weight in 3 months without trying, get them checked immediately. Blood tests, abdominal ultrasounds, and liver-kidney function assessments can pinpoint causes. More importantly, accept that this might be a natural sign of the body slowing down. Don't fixate on weight gain, prioritize their comfort. That's what they need most. Sign 2. Extreme fatigue and weakness. Persistent fatigue that doesn't improve with rest is a major shift in the final year of life. This isn't just sleepiness, it's an exhaustion that makes simple tasks like walking, dressing, or talking impossible. The body conserves energy as organs weaken, circulation drops, and oxygen doesn't reach muscles fast enough. Elderly individuals may sleep more, need longer rests, and struggle with daily routines. Throughout my career, I've seen hundreds of patients slip into extreme fatigue that can't be dismissed as just aging. It's a sign I always monitor when evaluating end-of-life stages, as it reflects a synchronized decline across multiple organ systems. Let's dive deeper into the medical reasons behind this and what you can do. First, extreme fatigue isn't like the tiredness you feel after a long day. It's a comprehensive state tied to cellular energy depletion. In the elderly, the body relies on adenosine triphosphate, the fuel for all activity. When organs like the heart, lungs, and liver slow down, ATP production falters. The result? Muscles lack energy to contract. The brain lacks fuel to process, and the body enters a conservation mode. Key causes include circulatory decline. The heart pumps blood less effectively, reducing oxygen to muscles and the brain. I often measure blood pressure and pulse. If systolic pressure is below 90 mm of mercury or the heart rate drops under 50 beats per minute, it's a sign the heart is struggling. Respiratory failure. Lungs don't exchange oxygen well, especially in those with COPD or fibrosis. When blood oxygen levels fall below 90%, chronic oxygen deprivation triggers constant fatigue. Metabolic disruption. The liver and kidneys fail to clear toxins efficiently, leading to uremia or waste buildup that leaves patients sluggish. I check creatinine and blood urea. If creatinine exceeds 1.5 mg per deciliter, kidney function is faltering. Another point I'd highlight is sleep's role. Many patients in this stage sleep 12 to 14 hours daily. Families often ask, is it bad they sleep so much? My answer: not at all. Sleep is the body's shield, cutting energy used to sustain basics like breathing and circulation. But if they still feel tired after sleep, look for issues like anemia or malnutrition common in my elderly patients. Psychologically, fatigue saps motivation. When the body can't keep up, the elderly may become apathetic, silent, or lose interest in hobbies. This isn't mere depression, it's a biological consequence of exhaustion. I've seen families push patients to cheer up with outings or chores, only to drain them further. My professional advice: monitor metrics. If possible, use a pulse oximeter to check SpO2 and heart rate. Below 92% at rest warrants a doctor's call. Avoid forcing. Don't demand overexertion. A comfy chair, warm blanket, and quiet space suffice. Watch closely. If fatigue pairs with shortness of breath or irregular pulse, check cardiovascular and lung health ASAP. It could signal acute heart or respiratory failure. Ultimately, extreme fatigue isn't fully fixable at this stage. Rather than pushing them to recover, focus on comfort, a gentle word, soft music, or just being there. That's the best way to honor their body's final efforts. Sign 3. Increased confusion or withdrawal. Memory decline, trouble focusing, or retreating from interaction are stark signs in life's final stage. Once sharp individuals may forget names, lose their bearings, or speak less. This isn't ordinary forgetfulness, it's the brain lacking oxygen and nutrients as circulation weakens. They might grow confused, lose interest in their surroundings, or become unusually quiet. As an elderly care physician, I frequently hear families ask, "Why does my dad suddenly forget everything?" Or, "Is mom mad at us because she won't talk?" In truth, confusion and withdrawal aren't just psychological, they're clear biological markers of the end-of-life phase. Let's explore the mechanisms and solutions so you're better equipped. Scientifically, the brain is hypersensitive to oxygen and nutrient shortages. As the heart and lungs weaken, a norm in aging, blood flow to the brain drops, reducing glucose and oxygen, the core fuels for cognition. I often observe metrics like low blood pressure. Systolic readings under 90 mm of mercury mean the brain isn't getting enough blood. Oxygen deprivation. SpO2 below 90% damages neurons temporarily or permanently. Toxin buildup. When kidneys and liver fail, urea and ammonia pile up in the blood, disrupting brain function, a condition called metabolic encephalopathy. Other underlying issues amplify confusion. Mini strokes. Brief brain blood shortages can cause short-term memory loss, often unnoticed by families. Vascular dementia. Brain vessel damage. Common in long-term hypertensives. Coexisting conditions. Hypothyroidism, B12 deficiency, or infections worsen the state. I'd also stress emotional withdrawal. As the brain declines, the prefrontal cortex handling emotions and social interaction suffers. The elderly lose interest in talking, not because they don't care, but because they lack mental stamina. I've seen patients sit silently for hours, staring out windows, not rejection, but self-preservation from overload. How to tell this from normal forgetting? I use the mini mental state examination. Scores below 20/30 signal significant cognitive decline. For families, watch for repeated questions or disorientation at home. If present, don't panic. It's a natural slowdown. My advice: keep familiarity. Don't rearrange furniture, change heightens confusion. Speak simply. Use short sentences, a warm tone, and avoid arguing over forgotten details. Medical checks. Blood tests, B12. Kidney function, glucose, and a brain CT if needed can rule out treatable causes. Accept limits. Don't force conversation or memory recall, it adds stress. Crucially, confusion and withdrawal don't erase who they are. They still sense love through your voice, gaze, and presence. Focus on comfort, not fixing the unfixable. Sign 4. Frequent infections and slow healing. A weakening immune system makes the elderly prone to infections like pneumonia or urinary tract infections. And wounds take longer to heal. Minor illnesses now linger, and even small scratches resist recovery. This shows the body no longer defends or repairs itself as it once did. In my career, I've noticed families often dismiss recurring infections and slow healing as minor ailments. As a doctor, I see them as loud alarms of total bodily decline. Let's unpack this medically for clarity. The immune system weakens due to fewer immune cells, white blood cell counts, and efficacy drop, impairing resistance to bacteria and viruses. I often see counts below 4.000 per cubic millimeter in late-stage patients, a dangerous low. Malnutrition. Lack of protein and vitamins, like C and D, starves immunity. Halting antibody production. I check serum albumin, below 30 grams per liter spells high risk. Poor circulation. Blood doesn't deliver enough oxygen and nutrients to skin and tissues. Slowing healing. This is pronounced in heart failure or diabetic patients. Common infections I encounter. Pneumonia. Often from aspiration in those with weak swallowing. A big issue as throat muscles fade. I suggest elevating the bed 30 degrees at night to lower this risk. UTIs. From immobility and hygiene challenges. Bacteria thrive. In the elderly, UTIs may lack fever, showing only fatigue or confusion, what I call silent infections. Skin infections. Bed sores from prolonged lying are severe if neglected. Slow healing stems from reduced collagen production, vital for skin repair. Poor circulation means oxygen and nutrients don't reach wounds. Stretching healing from days to weeks or months. Uncontrolled diabetes or venous insufficiency compounds this. My advice: hygiene first. Wash hands before care. Keep skin clean and dry, especially in moist areas like armpits or groin. Stay vigilant. Unexplained fatigue or mild fever. Check for UTIs or pneumonia pronto. Skincare. Use moisturizers to prevent cracking, and sterile gauze for wounds if needed. Limit antibiotics. Don't self-prescribe, overuse breeds resistance. When infections recur or wounds won't heal, the body's repair capacity is gone. Shift from curing to pain relief and comfort. It's the humane choice here. Sign 5. Major changes in breathing or circulation. Slow, shallow, or regular breathing, cold extremities, and pale or bluish skin signal the body prioritizing energy for vital organs. Cutting circulation to limbs. Breathing may pause, Shane Stokes, and slight movement can cause breathlessness. This is a clear end-of-life marker. I always tell families, when breathing changes, it's time to prepare. This is the final, most obvious sign of bodily decline, showing synchronized heart and lung failure. Let's break down the mechanics and support strategies. Breathing shifts like shallow or irregular patterns stem from respiratory decline. Lungs falter in oxygen exchange, often from COPD, fibrosis, or congestive heart failure. I measure SpO2, below 88% at rest is critical. Neurological control loss. The brain's respiratory center, in the brainstem, falters with low oxygen or CO2 buildup, causing erratic patterns like Shane Stokes, deep, fast breaths alternating with long pauses. Weak respiratory muscles. Diaphragm and intercostals weaken from malnutrition or muscle loss, limiting lung expansion. Circulatory signs, cold hands, feet, and cyanosis, reflect reduced cardiac output. The heart pumps less blood, prioritizing the brain and organs over limbs. I check peripheral pulses, if weak or absent at wrists or ankles. The heart's fading. Low blood pressure, below 90/60ths of a millimeter of mercury, and erratic heart rates are key indicators. These changes aren't just physical, they hit quality of life hard. Breathlessness on sitting up, persistent coughing from lung fluid, or coldness despite blankets exhaust and frighten patients. Families often panic at interrupted breathing, thinking death is imminent. Yet Shane Stokes can persist for weeks or months, the body's way of stretching survival. My advice. Comfort positioning. Raise the bed 30 to 45 degrees to ease breathing, avoid flat lying. Warmth. Use light blankets or socks for limbs, but not too hot to cause sweating. Oxygen aid. If SpO2 dips below 90%, home oxygen may help, per a doctor's order. Calmness. Avoid shouting or panic, your peace reassures them. When breathing and circulation fade, don't fight to save them. This isn't about treatment, it's about palliative care. Ensuring peace and pain relief is the top goals. After over 25 years with the elderly, I've learned that knowledge is the key to facing life's end. These 5 signs, weight loss, fatigue, confusion, infections, and breathing changes, aren't here to frighten you but to prepare you. They're the body's way of saying, I'm slowing down, care for me gently. My takeaway for you. Don't try to change the unchangeable. When they lose weight, don't force feed. When they're tired, let them rest. When they're confused, speak softly. When infections persist, prioritize hygiene and relief. When breathing shifts, stay by their side with love. If you spot these signs, stay calm, consult a doctor, and focus on quality of life over lifespan. This is the time to love, cherish, and say what's unsaid. Thanks for watching to the end. Drop a comment on what you've learned, I'll read every one. Hit like and subscribe for more insights. Wishing you health and peace.